With regards to today's COVID update, today the Houston Health Department reports 431 new cases of COVID-19, bringing Houston's total to 55,940. So today the number is 431. Unfortunately, we are adding 12 new persons to the list of those who have died as a result of COVID-19, which will bring that total, the number of people who have died who lived inside the city of Houston, to 585. So 431 new cases, people who have tested positive, and then 12 more people. Unfortunately, most of the people who have died are Hispanic, and as you can see on this list. And then in addition to that, there is one person in his 50s who died with no underlying health conditions. So again, we recognize that though our numbers in many ways from the hospitals as well as the numbers that we're reporting are starting to trend in the right direction, there are still way too many people who are dying as a result of this virus, and the disproportionate impact is on people of color, in this case particularly with the Hispanic community. The City of Houston Health Department is boosting its outreach efforts in the Hispanic community and other neighborhoods with a high positivity rate. Over the weekend, our Better Together Todas Juntas Mejor teams visited 981 units at 3 apartment complexes in high positivity majority Hispanic communities. And Councilmember Pollack, I believe they were in District J over the weekend. We are working to educate families about the virus. We are sharing information in English, Spanish, and other languages to help slow community spread and to stop the virus from continuing to take a deadly toll within our city. And getting tested is critically important. And many people who have the virus never show any symptoms. 40% of people infected with the virus never show any symptoms, but they can still spread this virus. And that is why it's important to protect yourself and others by wearing a mask and getting tested. And there are a number of testing sites that exist in the city of Houston. And the larger ones, Butler, Del Mar Stadium, doesn't cost you anything, and you don't even have to register for these testing sites, and they are available for you to go and be tested. Those are the nasal swabs. If you don't want the nasal swabs and you want to do the saliva test in your mouth, you can go to Minute Maid every single day, 8 to 4 p.m. Again, those are free testing sites. And so let me encourage people to take advantage of all, and those are just 3 of the many testing sites that exist all over the city of Houston. Please go and get tested. It's better to know than not to know. And so I want to encourage people, again, until there is a vaccine for this virus, please go and be tested. And if you haven't been tested, for example, in the last 30 days, then you need to go and get tested. If you've never been tested, then you need to go and get tested. So let me just encourage you to do that. It'll make you feel better. It'll make those you around feel better, so please do that. If you test positive, to protect your loved ones and friends, you need to isolate yourself and let those who have come into contact with you know about your positive test. And then when our contact tracers contact you, please don't hesitate to share with them the information that they are needing. It will help your family members and those that you have been in contact with. Again, let me encourage everyone to mask up. Please do that to protect others from you and protect them from you as well. So please mask up. And then again, we don't want anybody to get a $250 ticket. I am appreciative to the fact that when our police officers have approached people and warned them, people have put on their masks. And so that's good news, and I think that bodes well. Statewide, the positivity rate is higher than 20%. But in the city of Houston, our positivity rate as of, I think today, and Dr. Persse can correct me, is right around 14.3%. Which is, again, trending in the right direction, but we need to be at 5% or below. And that is the goal that we have set by the end of this month, the end of August. The goal is to bring that positivity rate down to 5%, to get below 5%, and then our testing and contact tracing program can really be very effective. And one of the major tools that we have to reduce that positivity rate is to wear a mask. Put that mask on, save a life, reduce the infection rate, lower the positivity rate, but that's where we need to be, especially as we talk about going back to school, on the other side of Labor Day. The positivity rate needs to be at 5% or lower than that. And slowing the spread, reducing the number of positive daily cases, and lowering the positivity rate, critically important, especially as our children start the process of returning to school. So that's the charge. That's where we are in the month of August. Want to provide you that report. If you come home and go to your home or your apartment and you see one of these door hangers, for example, in Spanish, that's right there with that cape on. Some people have been calling in thinking that this was a picture of me, Chief Acevedo. They saw the biceps. Let me assure you, this is not a picture of me, you know. But I can see how you can get confused. Congresswoman, yeah, you know. On my few days off this week, I have been, exercising and stuff. Let me stop. But let me just say, you got to laugh a little bit these days, because I tell you, there's too much stress and anxiety that's out here. Put your mask on, please. And when you're out and about in the presence of other people in public, put your mask on. If you do that, I promise you, if you do that, and if the city of Houston has compliance of about 90% or greater, I promise you, if you do that, the positivity rate in the city of Houston will come down, as it has started trending down in the city. From the hospital's perspective, based on the numbers that I've seen just this morning, the numbers are very encouraging. A few weeks ago, we had over 2,400 people in our hospitals. Today's numbers, that number may be around 1,200 to 1,300. We are no longer in that phase 2 of the surge in terms of our hospitals. It's all now within phase 1. Those are good numbers. And so the numbers within the hospitals are looking better. Even the positive rate within our community looking better, but we are not yet where we need to be. And let me encourage everyone to continue to be vigilant. And again, if you are sick, please stay home. And if you are not feeling well, okay, please don't hesitate to go to the hospital. Don't get so sick that by the time you get there, it's very difficult for even the best hospital system in the world to help you out. So please, if you're not feeling well, don't just stay there. Seek medical attention and medical care. Now let me pause and let me bring up Dr. Persse. That's not you either, Dr. Persse.
No, it's not. Thank you. Thank you. Mayor, you basically said it all. So I'm going to dive into some, getting a little bit more specific about our testing opportunities. As the mayor pointed out, we have plenty of testing opportunity in the community. And to remind folks that the number of folks who are going to our testing sites has decreased quite a bit. We're about a third of what we were at one point. So there's lots of capacity at the testing sites that we've had for a while, and now we have even more testing sites. So on the screen, you're going to see that we've got listed in cooperation with some of our colleagues at Del Mar and Butler Stadium. These are the two stadium sites that have been operating for months now. They are up and running and still available. And if you want to go to them, they can do up to 650 tests a day. And right now we're running it at about 250 tests a day. So there really shouldn't be much of a line. They run Monday through Saturday from 8 a.m. to 3 p.m. And if you want to go to Del Mar, you can call 832-393-4220 for an appointment. At Butler, no appointment is necessary. You can just show up and register on site. At Darrell Tully and Kingwood Park, those are two sites that we're working in cooperation with the U.S. Health and Human Services Commission. And they run from 10 a.m. till 7, and they're able to do actually 1,250 tests per day. So very huge amounts of capacity to get lots and lots of tests done. And to register for those, you can either go on site and register when you get there, or if you want to save yourself some time and you have access to a computer, you can register ahead at the email, the website, doineedacovid19test.com. Now that's a little bit of a mouthful, and it's a little bit of a keyboard full maybe, but there it is for you. doineedacovid19test, all one word.com, and that you can register very easily there so that when you get on site, you'll be processed through a little bit more quickly. And then finally, at Minute Maid Park in Lot C, there's another test site there that is running 7 days a week, and that's running from 8 till 4, as the mayor pointed out. And they can do 2,000 tests per day. So again, tremendous capacity. And no appointment is required, but if you want, you can register ahead of time at texas.curativeinc.com. That's texas.curativeinc.com. And that's the lab company that we're working with for that site. And they've got their webpage. And what I'm hearing from some of the folks who've gone there is that those reports are coming back very, very quickly. So with all these sites, there's an improvement in the lag time of the reports are coming back, and people, you're getting your own reports back very, very promptly. Now, those aren't the only sites. We have other sites. These are just our large, what we're calling our mega testing sites. We can go to the next slide. We'll be able to show you the other test sites that are available across the city, and there's another 15 or so neighborhood test sites that are available. And you can go to any of those as well. And again, the way to register is that same phone number that was for Del Mar at 832-393-4220. Or you can visit HoustonEmergency.org, and they will give you a map and get you some directions how. But you do need to call ahead of time to get the registration for those. And I want to reinforce something that the mayor said and that we've been saying all along. The importance of getting testing is especially for people who think that they may have symptoms or think they may have been exposed to someone. You need to know if you become infected. Now, remember, you can't get tested too early. So if you got exposed to somebody, you're at work or someplace today and you get a call tonight and they tell you that one of your coworkers tested positive. If you go tomorrow, you may get tested too early. You would need to test yourself again. You should quarantine if you were exposed, if you actually meet the qualification of a close contact. You need to quarantine yourself at home, but if you want to know if you then need to quarantine yet others, you would need to go and get tested again. So it gets a little bit confusing, but the bottom line is more testing, more testing, more testing. We have tremendous capacity to do it. And it's very important because, as the mayor pointed out, as we've been saying for quite some time, somewhere in the neighborhood of 40% of the people who are infected and are unknowingly spreading the virus are doing so because they don't have any symptoms and they think that they're totally fine. That's one of the things that makes this such a challenge. That's why we really want people to go out and get tested. In a perfect world, with a magic wand, I would have everybody in the city of Houston tested once a week. And if we could do that, it's totally impossible, I understand, but if we could do that, we would be able to identify everyone who is infected and get their contact tracing done and stop this virus within 2 weeks' time. That's not possible. We have to be realistic. But the one thing we can do is as you can see, we have tremendous testing capacity available. We can get a lot of folks tested. We can get you the answers quickly. And by doing that, you break the chain of transmission so that we don't wind up with the large numbers of people that are in the hospital. And I'm sure Chief Pena is going to talk about one of our firefighters who's the intensive care unit. And we need to consider that each and every one of these people who are infected and hospitalized, that was a preventable infection. Nobody was malicious along the way. Certainly somebody who didn't know they were infected, spread the virus to somebody else. Totally innocent, but also totally preventable. Thank you, Mayor.
Thank you, Dr. Persse. Chief Pena.
Thank you, Mayor. How you doing, Congresswoman? Before I begin, I come to you to humbly ask our community again to pray for Captain Persse, who's in the intensive care unit. I received word that he was intubated earlier today. He's going to need a lot of prayers, a lot of support, but we're hoping, again, for a full recovery. We did have one firefighter who was released yesterday from the hospital, firefighter Kerry Hunter, and he's going to continue his recovery. Keep them, please, in your prayers and lift up them and their family and the fire department through this very difficult time. As I get into my report, today we have 129 firefighters that are in quarantine. We've had a total of 234 that have tested positive for coronavirus through the course of this operation. Currently, we have 36 that are still positive. The majority are recovering at home, but we do have Captain Searcy, who's in the hospital, and firefighter Hunter, who was just released, and he's continuing his recovery. And we'll keep them both in our thoughts and in our prayers until they make a full recovery and come back to work. Our occupancy task force, over the last 24 hours, we've had 55 complaints that we responded to. The majority of them, if not all of them have been resolved voluntarily on site. So we appreciate, again, the business community for the assistance that they've been providing us and themselves in ensuring that we are adhering to the governor's executive order. Now, I want to talk a little bit about something else that we're noticing in looking at our statistics. So what we're noticing is that there are more and more signs that people succumb to diseases in their own beds, okay? Now, part of this could be because they came down with the virus and they didn't seek any treatment. Part of it could also be that they have other ailments that they didn't seek treatment for, or sought 911 too late. So a few numbers, we've seen an increase of about 47% in deaths outside the hospital that we respond to from February to July. From an average of about 14 per day in February to about a little over 20 per day that we're seeing in July. People are just waiting way too long to call 911. If you're having symptoms of a heart attack, chest pain, symptoms of a stroke, respiratory difficulties, do not wait too long to call 911. The notion that going to the hospital is where you're going to get this virus and catch coronavirus at the hospital, that is not based in fact at all. You are much safer calling 911 and being treated at the hospital than you are suffering and trying to ride it out in your living room. So again, we encourage our community to not wait too long to call 911. If you have a true emergency, health emergency or safety emergency, call 911 early. Do not wait too long. Again, the spike, almost 47% increase in the number of out-of-hospital deaths that we've seen just from February of this year. So please do the right thing for yourselves and your families. The fire department is ready to serve. Do not wait to call 911 and allow us to give you the best chance to get the best treatment at our hospitals. Thank you.
Thank you, Chief. Chief Acevedo.
Thank you, Mayor, and thank you for your leadership. And, couldn't help but add up just in that first page of testing available, Doc, and that's 5,000 just on the first page. And when you think about where we began, thanks to your leadership and to the help of all our congressional members, we've come a long way. And now it's just up to people to actually come out and get tested. I'm going to give you a quick report on where we're at in terms of our own department. Then I'll talk a little bit about enforcement. And then lastly, we'll talk about domestic violence. So as of today, as of this morning, we have a total of 129 members of the Houston Police Department that are in quarantine. 103 of those members have already tested positive, with 26 pending results. To date, we've had 459 members of the department that have tested positive, and 356 of the 459 have returned to work. And fortunately, we have only had 2 deaths, but we're holding at 2 deaths when you think about that many people getting sick. I want to extend my prayers again to our friends at the Houston Fire Department. We will be lifting up your members in prayer, and we'll be lifting up our community in prayer. But as in terms of enforcement, we've been fortunate. We've only had to do 2 incident reports so far. But let's just be clear. People talk a lot about patriotism, but I want to talk about being patriots and actually being courteous and actually being caring Americans. And that means that we've buried 2 firefighters. We've buried 2 members of our own family. And so the question is, do you want to be a patriot and think of others? Do you want to be a person of faith and think of your neighbors, your friends, first responders, the almost 200 police officers that have died of COVID nationwide? Or do you want to exercise your views that you have a right to get other people sick and ultimately cost them their lives? So I want to thank Houstonians, because unlike some other cities, most people, as we drive around, as we come up, are being decent, they're being thoughtful, and they're being Houston strong, which is, I think, once again, we're setting the way for the rest of the nation. So let's continue to be patriots, and let's continue to be Houston strong. Let's continue to protect one another and show our decency, our collective decency as Houstonians. And lastly, domestic violence. We know that there's a lot of going on at the congressional level, at the federal level, in terms of folks that might need help because they've lost their jobs, and we know that there's a lot of people hurting. And as a result, we're seeing domestic violence calls. We just saw it this morning, a report, I think it was this morning in the Houston Chronicle, to the families out there. Just remember, no matter how tough the circumstances may seem today, there will be better tomorrows, but those better tomorrows will not come if you resort to violence, if you resort to domestic violence. That is not the answer to anything. That's just going to exacerbate the problems for families. So we urge people, step away from each other. Give yourself some space. Give yourself some room. Go to a friend's house, a relative's house. Go to the park. Just get away from each other. And lastly, especially to the potential victims of domestic violence, know that we do have the full capacity of the Houston Police Department and all of our partners in the front lines, including our private sector partners with the Houston Area Women's Center and others, that we can get you help. Do not feel trapped, no matter what your financial circumstances are, no matter what you think the issues are for you. We have help for you. Please come forward. We're here to help you, because at the end of the day, what we want is we want healthy families, we want safe families, and we want especially our women and children to be safe. So we are fully operational, Mayor. Our partners are fully operational in this area, and we're ready to help, so please call us. And that's my report, Mayor.
Thank you, Chief Acevedo. I do want to highlight to the congresspersons that we use some of the CARES money that we received in the initial package to assist on domestic violence, and quite frankly, even more is needed. So, Congressman Green, I know you are now here. Maybe if you can give us just a brief update on where we are, possibly in terms of additional funding. And Congresswoman Sheena Jackson, you can follow.
Thank you very much, Mayor. 2 points to make. The first is with reference to the testing. I think it's important to say that I have honored your request. I have been tested twice. I don't have symptoms that I'm aware of. I do wear my mask. So I encourage others to behave similarly. With reference to where we are in Washington, D.C., the House has passed a $3 trillion plus package. It includes help for municipalities, local governments, state governments. It also includes monies for those who need help with evictions. You were very generous in working to help persons who were about to be evicted, and it's my understanding that some $15 million was out the door in a matter of minutes. We need to help. My committee, the Financial Services Committee, has appropriated in the HEROES Act $100 billion to help those who are being evicted. Also, $75 billion to help those who are homeowners. We also want to make sure that we get the money to pay the rent, because we cannot assume that the landlords can bear the burden of not having rent paid. So this payment of rent is important, not just a moratorium. A moratorium is better than having people evicted, but having the rent paid is of paramount importance. So I'm proud to say that my committee, under the leadership of the Honorable Maxine Waters, has made it possible through the CARES Act for us to help the renters and the persons who own property as well. Finally, it is important to note that These are very difficult times for everyone. We should not assume that anyone is having a great time of it. And because they're difficult times, please reach out to your neighbors. Check on your neighbors. Find out what's happening with them. I know that you can't traverse the streets as much as you would like, but you can make a phone call. Let people know that you care about them, and in return, hopefully, they will reciprocate. I thank you, Mayor. Thank you to my colleague, Jackson Lee, council member who is standing behind me, or he was when I came to the podium, Dr. Persse, who's over to my left, if I'm still correct. And thank you ever so much for the opportunity. Thank you.
Mayor, thank you for letting me join you on the announcements of the numbers that you've made. Let me, in this moment, thank you for your hard work. We are where we are because the city was not shy in going full approach to testing. Let me thank and acknowledge my colleague. I think it is important that we're both here today really focusing on the same points of support and advocacy for the city, and as well, as usual, to thank Dr. Persse, Chief Acevedo, and Chief Pena. My heart goes out, my prayers go out to all of the men and women who are confronting during their jobs this COVID-19 that has a mind of its own. I want to focus on the fact, Mayor, that I think if we reflect or look at cities, and I'm seeking those numbers, Houston has actually been a major leader on testing. Our access to testing has been enormous. And if you engage with other cities and states, we find that there are challenges that we have tried to confront head on. But it is still important to note that on the national spectrum, Texas, Florida, and California still remain at the highest level of cases as states. And it is very important that scientists are still saying that we should have the jurisdiction to have stay-at-home orders if determined by local officials. And I make that plea again, stay-at-home orders if determined by local leadership, I believe is very important. But testing has been certainly a very important action, and it has been positive. I want to thank you, Mayor, for joining me on my faith initiatives where we have opened testing sites in faith institutions. We look forward to going to the Living Word Fellowship Church this coming week, where we try to reach out to people who are underserved and who are able to come on days that they are not working as essential workers, which includes Hispanic and African American communities and others. I want to finish on the point that it is, I believe, the advocacy of all of our citizens. I heard a plea being made by Chief Acevedo for us to treat each other as if all of us are good Samaritans. We need to continue the advocacy and the support that Congressman Green and myself and other colleagues are doing to get the mayor the funding for local and city governments, county governments as quickly as possible. The strategy and negotiations are still available for creative thinking, if you will. And I think the most serious needs are for your funding. When I say your funding, local and public funding coming from the federal government so that essential services can continue. The money, Dr. Persse, for testing so that we can continue testing and contact tracing, and particularly in hotspots with Hispanics and African Americans and other vulnerable populations. And then finally, I think it is very important. I don't think any of us can turn on any form of media without hearing the new attitude that, yes, children can become infected or positive, and they can transmit. The main thing that we need to do is to give our school districts the extra COVID-19 funding to be able to ensure that whatever decision is made for opening, they have all the resources necessary for parents, teachers, bus drivers, children, janitors, and anyone else to feel safe. That is an imperative, and I'd almost say that we need to move those dollars right now to our local jurisdictions. I joined with my colleague on the eviction dollars, and I'd only make a plea that if corporate Houston can help the city on support more than they have already done, it is extremely important that we do so to stop evictions and foreclosures for our community. Thank you.